Good morning.
Thanks for taking some time to join us this morning on the Morning Scramble. We really want to get into what the world looks like now. We're kind of in this, the term new normal keeps getting floated around.
Yes.
But let's start with when you were first here was things like washing your hands and not touching your face and covering your cough.
We're not shaking hands, we're bumping elbows.
Yeah.
I remember bumping elbows with you, Heather.
All of those
right.
good pointers, but that world has since changed. And now recommendations like social distancing and, again, not making contact, wearing masks, that is still kind of the rule right now. Is that correct?
That is still the rule. So all those things we talked about before, we still want people to be practicing. So continue to clean your hands often with soap and water. Continue to cover coughs and sneezes. Continue to stay home when you are ill. But in addition to that, we want people to be social distancing. We want individuals to be 6 feet apart or greater. And if you're going to be in a situation where you don't know if you can be 6 feet apart or greater, say you're going to the grocery store and you can't guarantee that you can maintain that social distance at all times, then we want people to wear a cloth facial covering. And that cloth facial covering is not to protect you, but it's to protect everybody around you from anything that you may be carrying unknowingly.
That was something I wanted to really make sure that we got to, because we know there's been a lot of community events that are really rallying to show support for frontline workers and all of the people who are doing so much. But unfortunately, in those social situations, there are opportunities, even accidentally and subconsciously, you start talking with people.
Yeah, like maybe I just didn't bring my mask to this because I didn't think I was going to be getting out of my car, but then I did.
And you were just, I think, speaking last week about something that you've seen an uptick in, that's community spread. We had this let's flatten the curve before. Is let's stop community spread. Can that kind of be a rallying cry right now?
It would be a great rallying cry. So what we're seeing is more and more community spread. We're still seeing outbreaks occur in different areas, such as long-term care facilities. You'll hear about that quite a bit in the news. We still hear about outbreaks happening at facilities such as meatpacking plants. But what we're also seeing is that community spread, where a person is passing it to a neighbor, they're passing it to a coworker, they're passing it to a friend. And then we have people that don't know where they got it from. They don't know anybody that had COVID-19, but now they're having symptoms and they are ill. And that's that community spread where you unknowingly, unwillingly pass this virus to somebody else. And it's important to remember that it can take 2 to 14 days for those symptoms or that illness to show up. So being ill today does not mean that you were exposed just yesterday. It may have happened 2 weeks ago. So it's all those things that we do today that will have an impact later on to somebody else.
But Heather, if we do get sick, what's the protocol? If we think that we're experiencing symptoms, what do we do?
So, and again, this is a new virus and we're still learning about it. So it's really important to remember that recommendations will continue to be updated throughout the course of this whole event. So symptoms that people want to watch out for are things that we've talked about in the past, such as cough, shortness of breath, difficulty breathing, fever, but we've expanded that list now to include things such as having the chills, muscle pain, sore throat, or a loss of taste or a loss of smell. So if you start to experience those symptoms, what we want you to do is call your healthcare provider. Before you do anything, before you go anywhere, stay home, don't go anywhere, and give your healthcare provider a phone call. They will talk to you about what your symptoms are, what's going on with you as far as your illness progression, what you do for work, where you may have been exposed. And then together you'll come up with your plan if you need to be tested, not to be tested, and what your next steps are going to be.
Speaking with Heather Meter this morning with Linn County Public Health, learning a lot about what 2 months ago was just cover your cough and don't touch your face, to now a world of social distancing, and we're doing everything we can to really reduce and try to eliminate community spread. Heather, last week was a weird week. There were a lot of videos popping up online full of misinformation, and I have a feeling that we are in these ebbs and flows of conspiracy theories right now, and it takes some time for these things to be taken down, and unfortunately it's giving the wrong information. Where should people be going for accurate, timely information?
Yep. For anyone that lives in Linn County, we would encourage you to go to the Linn County website. We have lots of great information on our website regarding COVID-19, lots of helpful tips on there. So go ahead and go to our website. There's a lot of links on there that will take you to other websites with accurate, factual information. Besides going to the Linn County website, you can always go to the Centers for Disease Control and Prevention, the CDC. You can go to the World Health Organization. Those are all great places to go for science-based information. I would stay away from social media as your place to go for the most factual information regarding COVID-19. Because again, this is a novel virus. This is a new virus, so we're still learning about it. And on these websites, you will see as things come up, as we learn more, that information is being updated. And you'll see little spots on there that say information update.
So make sure that you're looking for your resources in the right place. Heather Meter with the Linn County Department of Public Health, we thank you so much for sharing some time with us this morning. Thanks for being a wonderful resource for us to get some factual information.
Oh, thank you so much for having me. I really appreciate it.